Hi, my name is Victor. I'm going to be going over the new stroke alert protocol as well as going over a brief review on TPA administration. So Innova is moving to the BFAST stroke criteria. So BFAST stands for balance, eyes, face, arms, speech, and time. So by this, I mean if a patient's having any issues with their balance, any visual changes like issues with their vision, any facial asymmetry, or any unilateral arm weakness or expressive or global aphasia or any differences in their speech, you can call a stroke alert. Any patients with any of the above symptoms with a last known normal of greater than 24 hours is eligible for a stroke team stat consult, and they will come down within 30 minutes. The stroke alert flow sheet is a mandatory tool. It assists with getting everything ready for the stroke alert, as well as tells you exactly what you need to do while caring for patients who are a stroke alert. So up top, you'll see everything that you need to get ready before the stroke alert arrives. This is just some reminders that you need a patient's exact weight, the transport monitor, charged bed with a scale to weigh the patient, and a glucose monitor. To administer TPA, you need to get TPA, a 100cc bag, and the stroke kit, which can be found on the side of the AccuDose on Trauma Bay 1, as well as underneath the computer in front of the Southside AccuDose. The stroke kit includes a 50cc syringe, some gauze, so vented IV pump tubing, a 10cc syringe, some alcohol prep pads, as well as a dosing regimen for alteplase. So you can actually use this. You can find the patient's weight. So if we're doing a 180-pound patient or 81.8 kilograms, you can see their total dose will be 73.6 milligrams. Your waist will be 26.4 milligrams. Your bolus dose will be 7.4, and then your infusion dose that will go over 60 minutes will be 66.2. So when you're ready to administer the TPA, you can open up the box. You'll have 100 milliliters of sterile water, as well as the alteplase in powder form. So what you'll do is you will take the transfer device, you will spike the sterile water, and then you will take the TPA and you will spike it upside down and then flip it over so that the sterile water can flow into the alteplase. Once all the sterile water has been successfully placed into the vial with the TPA powder, you can remove the vial as well as the spike. To mix the TPA, you want to either grab it from the top and swirl it gently, or take both your palms and mix it like this. You don't want to shake it up because that will disrupt the molecules in the TPA and it will not work as intended. It typically takes about 1 minute for the TPA to completely mix and dissolve, but you just want to keep an eye on it and make sure that there are no clumps of the powder. Once we are done with the mixing, we can now take our waist. For the card, you find the patient's weight. We're doing a weight of 81.8 kilograms. So you can see that the discard quantity will be 26.4 milliliters or more. You can take your 50cc syringe, and then take your waist out. Once you have your waist pulled up, you can verify it with your second RN. And you can put it to the side labeled as TPA waist just in case anything happens with any math issues or with the bolus dose. So then you will take your 10cc syringe and you will pull out your bolus dose. So per the card again, the bolus dose is 7.4 milligrams or 7.4 milliliters. So that's what you'll be pouring from tube. So with your vented tubing, you spike the TPA vial. So you will find when you type in Alteplase for TPA that there are a few protocols, and we'll be using the stroke protocol. It will give us some advice on the bolus dose and weighing the patient. So we just press OK, and then we'll program our pump. Using the dosing regimen and your second verifier, you can find the infusion dose. So it's 66.2 milligrams. So you can program the dose as 66.2. Press OK. So it'll automatically program the rate, and then the volume to be infused will be also 66.2. When you're giving the TPA, you want to make sure that you're keeping an eye on your IV pump as well as the vial, because you will need to, as soon as the vial is empty, you will have to transfer it over to a 100cc bag, so that way the entire dose of TPA can go into the patient, and you can run it at the same exact rate. You'll be able to give your bolus over 1 minute after verifying with your second RN. And then once the bolus is complete, you can hook up the IV pump to the patient and begin your administration. This is the TPA flow sheet. This does not replace any Epic documentation that you're going to do, but it is a good tool to keep track of your Q15 vital signs as well as your Q15 MEND exams that you're going to be performing on the patient. So you'll hand this off to the neuroscience ICU RN once the patient is transferred, and you will complete your documentation on Epic as well.